Welcome to Fit, Faith, and Purpose 360 Total Woman podcast with Deirdre, aka D Banks. Listen, here on this podcast, we're going to be talking about living a fit, faith, purposeful life for women over 40, the over 40 body changes, finding balance in healing in your mind, body, soul, and spirit, what your purpose is, and my favorite, discussing the Word of God and how to apply the Word of God to your life. So sit back and enjoy the ride. Again, I'm your girl Deirdre, aka D Banks. Welcome to Fit, Faith, and Purpose 360 Total Woman podcast. I am your girl Deirdre, aka D Banks. Listen, I am excited about this podcast. Okay. There's two reasons why I wanted to have you in on this discussion and to bring this podcast to you all. Is one, to share my journey. Two, so that you will have valuable information that you can discuss with your doctor or healthcare provider should you have to make a decision like this. And also, if you're looking for a doctor who can help you with this, I hope that you would choose Dr. Krisht, who will be able to help you make a good decision that he's going to help me make today. So let's get this started with this conversation. Dr. Krisht, welcome, welcome, welcome. I want to have this discussion with you so that people can hear how you discuss back surgery with your patients, because I am now going to be your patient. So I just wanted them to hear you describe what that process looked like, and also what my pre and post op is going to look like as well. So can you say hello to the people?
Hello, Dee. Thanks for having me on your podcast again. I'm happy to be here, as always. Thank you for entrusting me in your care. We touched upon a lot of degenerative disc disease and back pain in your last podcast. And what I'll do today is briefly go over some of the things that we look at and how we come to the decision of what needs to be done, and if you're at a point where you're needing surgery and if this is a good time for it. As always, as much as we love to operate as surgeons, we like to really leave surgery as a last-ditch effort or last resort in the event that conservative management doesn't work. And that's kind of the approach that you want to take, especially when dealing with degenerative disc disease, where we're not really involved with a life or death issue here. This is purely a subjective issue that pertains to quality of life, and if you're able to, how you're functioning, as a person, as a human being. Are you doing what you want to do? Are you happy? Are you in a good place, or is the pain really getting to you to where it's a constant nuisance and it's impacting your day-to-day activities and your quality of life? And if it's the latter, and you've exhausted all the conservative measures without seeing any meaningful benefit, then you're really at a point where you're needing surgery, and you're going through that decision making as to, is this a good time? And knowing and understanding what surgery entails as far as the surgery itself, the immediate post-operative course, and the recovery involved is going to help you make that decision. But briefly, we like to start with conservative measures of therapy. That can include physical therapy, over-the-counter pain medication, or analgesics like non-steroidal anti-inflammatories, and that would include ibuprofen, Advil, Aleve, and some of those products, as well as physical therapy. Chiropractors can be helpful. Other alternative methods, such as acupuncture, can also be helpful. There's nothing really that's going to be injurious to your lower back if it's done by a professional and someone that deals with pain. If after spending quite some time, we're talking at least 3 to 4 months or so, without really seeing any meaningful benefit, then there are other things that we can consider, such as injections, and those would include injections that are around um, the nerve that's being involved, that's being um, entrapped by the disc or pushed on by the disc, to help and alleviate the inflammation around that region or the inflammation in the nerve, to see if we can have any sort of improvement in the pain. And if that fails, then we're really sort of squeezed and cornered. We don't have many options left besides surgery. So those are sort of the steps that we like to take initially before jumping to surgery. Now, obviously, there are exceptions to the rule. Like with anything, there are times where you may have a very large disc extrusion that's causing severe compression of the neural elements, and that needs to be addressed on an urgent basis because that can cause symptoms of what we call cauda equina, where you can have bladder issues and you can have weakness in your legs and severe numbness in the saddle area and in your legs. Those are things that we can't wait on. But a lot of degenerative disc disease is predominantly pain related, and therefore we have the luxury of waiting and trying to treat it conservatively to avoid surgery. And sometimes surgery cannot be avoided after, exhausting all our conservative measures, and that's when we decide to go ahead and move forward with doing something about it.
So, in my case, I had to go to the emergency room a few weeks ago, and because I was experiencing right back pain that was moving around to the front and also radiating down the leg with numbness and sharp pains. After reviewing my MRI, I want to share with the people what were the options that you gave me, and then we'll just have the back and forth discussion as to the option I chose.
Yeah. So someone like you has been a patient of mine for over a year, where we've done MRI studies in the past, and we know we have an idea of what your baseline issue looks like. We have something to draw comparison to, and so with this new MRI, with the sort of resurgence in your symptoms, and the new MRI that we got when you came to the ED, we're able to compare it to the old MRI to see if there's been any change. And that's another important element or factor that we look at is the radiographic findings. Has there been any change since your last image? And in your case, Dee Dee, your disc looked bigger. There's more inflammation going on, more compression of the nerve, and your symptoms were certainly getting worse. So there's a progression to the disease process. Again, we're still not at a point where it's impacting your bladder or impacting your nerve function to where you can't walk, to where you have dense numbness or severe numbness. And so we go back, as far as the options, we go back to three different options. Either continued conservative management, which you've been doing, epidural steroid injection, where we inject a combination of a numbing medicine and steroid around that nerve that's being impacted. And the third option is surgery. Now, after going through this for some time, and with the imaging showing that things are getting worse, continuing to do what you're doing may not be the best option, but it's there. It's a choice, so long as you don't have any deficits. But the cost of doing that is that you're not going to get any pain relief. And if we go base it completely based on the history, it's going to get worse. And so the other two options are the injection versus surgery. The injection is really a temporizing measure. It does not address the root cause of the problem. It's aimed at alleviating the inflammation that's caused by the disc that's putting pressure on the nerve. So we can get rid of the inflammation, but as soon as the medication wears off, that inflammation is going to come back because that compression is still there. So, the nice thing about the injection is it can buy you some time before surgery, and it can also serve as a diagnostic tool. So if the injection works and gives you significant pain relief, even if it's short-lived for a couple weeks and the pain comes back, we know that that is the source of your pain, that your pain is coming from that region. And we have a culprit at hand, and we know if we have to go in surgically, that we have a high guarantee of giving you a very successful outcome.
So for me, I did not want the injection because I know it's a temporary measure, and I am over the pain. I am over the numbness, and I am ready to do something about it. So with that being said, then what is the surgery and what is the recovery time and how long is this surgery?
Yeah. So that's a great point. So there's times where I would dissuade you from jumping straight to surgery before the injection, and that's in an instance where this is early on. It's your first MRI. The symptoms just started to happen, and you have um, a very soft disc herniation, and this is a first time image. So I think then it's worthwhile doing. It would be worthwhile doing the injection to alleviate the pain and give the disc some time to shrink and go away with the hopes of it doing that. However, in your case, we have had a progression in the disc and a worsening over a year. So chances of it going back and getting better, very unlikely. And with all, different patients and different age groups, the disc is different and behaves differently. At your age group, when we see this disc and we see the progression, the chances of it being a very soft disc that's just going to sort of shrink back on its own, very unlikely. As far as surgery to take care of this, what we do is we shave a little bit of the what we call the lamina, which is one of the structural parts of the vertebra in the back part of the vertebra, to give us access down to the canal space. And the nice thing about the lumbar region is we're really not dealing with the spinal cord. We're dealing with the nerve roots. Those nerve roots are housed and encased in the dura, which is the covering that protects those nerves, and they're bathed in spinal fluid. So when we get down into the canal, we carefully mobilize the sac to get down to where that disc is, and then we remove the disc that is protruding out and putting pressure on the nerve. We don't take all the disc out. We only take the unhealthy disc that is sitting outside of what we call the annulus, or the ligament that keeps the disc in place. And then we follow that disc into the disc space to make sure that there are no residual disc fragments that may eventually re-herniate in the future. So the last thing we want to do is do a beautiful surgery, everything goes great, and then a week later the patient comes back with the same symptoms because of a small disc fragment that was left in the disc space. But again, the goal is to remove the diseased disc, the disc that is not attached to any ligament, that is not functioning like it should, and that is in a bad location that's causing problems. Surgery like this typically takes about 30 to 40 minutes, and a lot of my patients go home the same day. This is done through a very small, minimally invasive incision that's about 2 centimeters. We use the microscope, so everything's magnified 40 times, and we do a very limited exposure of the area where we need to shave the bone and get down to that disc without having to go through, minimizing the amount of tissue trauma that we do essentially. And so because of that, the operative time is reduced, the healing time is reduced, and patients are able to get up and walk immediately after surgery. And a lot of these patients who have severe pain, the surgical pain associated with the surgery itself, that sore spot in the back where the incision is made, is a very, very small price to pay for getting the pain relief that you're going to get. And a lot of these patients are super excited and happy. They're ready to walk out immediately after surgery.
Okay. So how long is my healing time?
Right. So healing time, I usually want patients to take it easy for 4 weeks, and that means very limited activity in terms of. So we don't want patients exercising. We don't want patients doing any strenuous activity. We don't want them overexerting themselves. No heavy lifting, no more than 10 pounds. We want them to do just simple chores, simple walking, simple stairs. You should tell patients they can make themselves a sandwich, do some simple dishes, but this is not a time to come up with big projects, not home projects or yard projects or anything like that. And certainly no driving and no operating heavy machinery, at least for the first 2 weeks until the incision heals. For a one level disc, such as what you will be having, I ask my patients to avoid driving for 2 weeks. I think it's reasonable to start driving after 2 weeks, as long as you restrict your driving to a short distance. Usually like to give a number and say a 10-mile radius, but no long distance driving, and no long hours of driving essentially.
Okay. Well, I hope this is helpful to you all. I am nervous, but I do trust you with my life. I've known you for a long time, so I know I am in great hands, and I am excited to get this pain over, to get back to my life and get back to normal. So I'm excited. I hope this podcast has helped you guys make a decision if you're having to be put in a position like this, and what to look for and questions that you need to be asking your physician. And if they need help from you, Dr. K. Krish, how do they get in contact with you?
They can call our office. The best way to find our location is to Google my name, um, using the Google search engine. Just type in Khaled Krisht. That's Khaled. Last name Krisht, Krisht, and you'll have all that information there. You can also visit my Facebook page at Khaled Krisht. It's Khaled Krisht MD, and give us a thumbs up. And you are free to post comments and send messages, and be glad to get back to you and sort of guide you in the right direction.
Alrighty. Well, again, I want to thank you so much for allowing me to pull on you and to talk you into sharing my journey on this podcast, so that it can help someone. I really, really appreciate you a lot for being there and your support, and for helping me through this process and to make a difficult decision. So I'm very grateful and thankful for you for that as well. As for all the other ladies out there, as I end all of my podcasts to say thank you so much, that I love you, God loves you, and really there's nothing you can do about it. Bye for now.